The presentation I wanted to focus on for this update was from Dr. SAGI DENENBERG, and that was called Pathophysiology of Behaviour, How Physical and Mental Diseases Interplay. Now, he started off by stating that behavioural changes are often the first and sometimes the only sign of an underlying physical problem. And in Dr. Denenberg's experience with his practice, he estimates that nearly 70% of his caseload involves pain-related behaviours. And he also states that pain is a significant contributor to changes in behaviour. And he also talked about how our dog's behaviour can vary based on not just where the pain's located, but also where it's originating from, and also whether it's been an acute pain or a chronic pain, one that's been going on and that the dog's been trying to cope with for quite a long time. And also how that pain feels and whether that dog is adapted to that pain or not. And it may be that there's a point in time where the dog may have adapted to that pain, but now it's getting to a stage where the dog can no longer cope with it anymore. And of course, behaviour changes are what we're going to see. Now, Dr. Denenberg highlighted a number of different causes for pain with respect to the different body systems. So, of course, if we think about the urinary tract and the kidneys, gastrointestinal pain, but surprisingly, acid reflux is a significant disease in dogs and a painful one for dogs too. So that is an interesting little bit of food for thought there. Other medical conditions like deep skin infections and orthopaedic diseases, bone pain, joint pain, those types of diseases again cause pain, and they can cause a syndrome called acral lick dermatitis. And basically that's brought about from chronic and excessive licking, chewing or grooming of a particular area that may feel painful to that dog. And that excessive licking and chewing, that excessive self-trauma to that area of the skin results in hair loss, inflammation to the superficial layers of the skin, and also infection. And it also prevents the area from healing because it's an excessive licking and chewing and self-trauma to that area. So it's constant. And what we have with that continued inflammation is a reddened, raised and very thickened area over that area where it was deemed painful by the dog. So with these skin diseases resulting from self-trauma, Dr. Denenberg also said that we see compulsive behaviours with these sorts of diseases. And of course, we can see aggression towards people who try to stop the dog or interrupt the dog from excessively licking and chewing at those painful areas. Now, I want to take a closer look at pain from our dog's perspective and what we might see in the form of behaviour changes. And Dr. Denenberg stated that commonly we can see avoidance behaviour, so our dog is going to remove themselves from the situation completely. Of course, as I mentioned earlier, they may demonstrate aggressive behaviour and also house soiling, so accidents in the house, toileting in the house. And let's put that all into context with a really nice example that Dr. Denenberg gave us. So if we think about a dog that has joint pain, maybe our dog's getting a bit older, maybe they're not as mobile, maybe they're not able to move away from the kids as quickly, the grandchildren as quickly as they were able to before, move to a quieter area. Maybe they were happy with children approaching them, picking up the dog's toys close to the dog. But now that the dog's in pain, this sort of stimuli is now triggering a change in those behaviours because the dog isn't able to cope with the stress of that situation on top of the pain. So the pain is actually causing the changes in behaviour, which could be a growl or a lip curl, a growl or a snap at a child approaching that dog when they're feeling painful and not able to escape from the situation. And if we think about how we might feel when we're sick, we don't really want people encroaching on our space, reaching out and making, sort of contact with us and touching us. We just want to probably find a nice quiet place and just rest, lie down in peace and quiet. So this is especially important to consider, once again, when we have situations of older dogs that may have joint disease. Okay, so they're painful, they're less mobile, not able to escape from a situation, but more importantly, it also disrupts their ability to take themselves out to go to the toilet in the way that they used to. So it's very important that we also understand that from our dog's perspective as well, that this medical painful condition is causing changes in our dog's behaviour and contributing to that dog's behaviour. And once again, training isn't going to help this dog because it's the pain of the medical condition that's contributing to the dog's aggressive behaviour or house soiling. So this needs to be investigated and treated by a veterinarian. And just as importantly, just a note on the body language clues that dogs give us, we should never be punishing our dogs for growling at us because that's really valuable information and they're communicating their distress and also their emotional state very clearly. And it's basically saying, you know, please just leave me alone, give me some space and just don't come any closer. So we need to be respecting that crucial piece of communication from our dogs. And usually this is very often the only piece of communication or body language vocalisation that we pay attention to from our dogs in many everyday situations. That's the one that gets our attention. But of course, our dog would have demonstrated many, many other body language clues that were more subtle that we hadn't noticed or ignored. Now, a really interesting point that Dr. Denenberg raised was that we need to be aware that many behaviours that our dog might show that result in self-trauma, like chewing or licking, excessive grooming, or even eating foreign objects without any apparent reason, they actually may be related to or originating from a primary behavioural disease like anxiety. And Dr. Denenberg stated that anxiety can exacerbate the pain sensation. And most interestingly, when we're thinking about the diseases, the skin diseases or the behavioural diseases that can result in those physical lesions associated with the self-trauma, like the excessive licking, excessive grooming, chewing, biting, when we think of those diseases, the anxiety and the sensation of pain and itch associated with those diseases, they're all neurologically related at the level of the central nervous system, which is the brain. So that's a really interesting and fascinating point. And so it's really crucial that dog trainers and veterinarians are working closely together, because then we're making sure that every dog is receiving the right care and is also being referred to the person that they need to be referred to. And of course, the role of the veterinarian is to diagnose and treat medical diseases. So once again, it's so important that trainers, veterinarians working closely together, every dog is receiving the right care, the best outcome for their individual situation. And it also means that when we're working closely together, we're on the same page and we're putting our focus on not just the physical welfare of dogs, but the mental health and welfare of dogs as well.